Hey there, and welcome to Scaling Up Your Impact, the podcast where we help therapists grow their skills, confidence, and impact. At Scaling Up, we're passionate about offering free content and support because we believe in the incredible work that therapists are doing in the world. Hi, I'm Kelly Smyth-Dent, the founder of Scaling Up, and in today's episode, it's just me, sharing thoughtful insights from our team and our amazing community of therapists. But before we get started, please be sure to sign up for our free weekly newsletter. Each week, we'll send you the latest podcast episodes along with related workbooks, tools, and tips to help you put your ideas into practice. You can subscribe either at scalingupemdr.com or you can find the link in our show notes. It's free and designed to support your growth. We're so glad that you're here. Let's dive in. Hi, everyone, and welcome back to Scaling Up Your Impact, the podcast for trauma-informed therapists who want to grow their skills, serve more clients, and create lasting change without burning out. I'm Kelly Smyth-Dent, and today we're diving into a topic that is close to my heart: how EMDR can be used across a variety of treatment settings, from eating disorder hospitals to addiction recovery centers to inpatient and residential mental health facilities. If you've only thought of EMDR as something to do in private practice, today's episode might open your eyes to the incredible impact that this therapy can have in more intensive, multidisciplinary settings. So let's start with treatment centers. They're often serving clients with complex, layered histories, trauma, comorbid diagnoses, and acute symptom presentation. These clients are often in an environment where they have access to daily support and monitoring. They may be away from their usual triggers and stressors, and they're already engaged in structured multidisciplinary care. EMDR can fit beautifully into this kind of ecosystem because it addresses underlying trauma that may be driving presenting symptoms like eating disorder behaviors, substance use, or mood dysregulation. It can be adapted to the client's stability level and stage of treatment. And the intensity of a residential or inpatient program allows for closer monitoring after sessions and coordinated support from other staff. Simply put, treatment centers often create the ideal containment for safe trauma reprocessing. Now, eating disorders are often deeply intertwined with trauma, whether it's overt trauma like abuse or more covert developmental wounds. In eating disorder hospitals, EMDR can address traumatic memories that trigger disordered eating behaviors, help clients process body image related experiences or medical trauma from past hospitalizations, and also reduce shame and self-criticism tied to adverse experiences. Some clinical considerations might be the medical fragility of clients means pacing and timing are critical. Sessions may need to be shorter or more stabilization focused in early treatment. Collaboration with dietitians, physicians, and nurses is essential to avoid overwhelming the client during a period of nutritional rehabilitation. And target selection may start with smaller, contained memories rather than diving into the worst thing right away. Now let's talk about addiction treatment. In addiction treatment, trauma is often both a precipitating factor and a relapse trigger. So EMDR can be used to address the underlying trauma that led to substance use as a coping mechanism, reduce reactivity to triggers that could cause relapse after discharge, and reprocess distressing events from active addiction, example overdoses, losses, or interpersonal conflicts. Some clinical considerations include many clients are in early recovery, meaning they have limited tolerance for emotional activation. Sessions may need to be shorter and paired with strong resourcing. And staff collaboration is key. So EMDR sessions should be integrated into the treatment plan alongside group therapy, 12-step work, and other modalities. Now, inpatient and residential mental health facilities often work with clients in acute crisis. severe depression, suicidality, PTSD, dissociation, or psychosis. In this case, EMDR can be beneficial here when the client is stable enough to tolerate reprocessing without destabilizing. The focus is on smaller recent traumas or installing positive resources. And the therapist is collaborating closely with psychiatrists, nurses, and case managers. In some cases, the goal may not be fully reprocessing during an inpatient stay. Instead, EMDR sessions might focus on stabilization, preparation, and target identification. So the client leads with a roadmap for continued outpatient trauma work. Regardless of the setting, EMDR in treatment centers requires flexibility and teamwork. Some key adaptations include potentially shorter session blocks, so 20 to 40 minutes if needed. Group EMDR protocols like the EMDR IGTP or GTEP to reach multiple clients at once in educational or processing groups. Increased preparation work for clients with high dissociation or instability. And frequent check-ins with other staff to ensure consistent messaging and containment. The more integrated EMDR is into the program's culture, the more effective it will be. So while EMDR is powerful in private practice, using it in high acuity settings calls for additional skills. Knowing how to titrate processing for clients with high symptom severity, understanding medical and psychiatric considerations, working seamlessly in multidisciplinary teams, and adapting protocols to fit program schedules and constraints. This is why we recommend ongoing advanced trainings, especially in areas like complex trauma, dissociation, and group protocols. So if you work in or want to work in a treatment center, EMDR can be one of the most valuable tools you bring to the table. It's adaptable, evidence-based, and addresses the root causes that often keep clients stuck. And if you want to expand your skills for these settings, Scaling Up offers advanced EMDR trainings like our EMDR GAP training, which includes group protocols and our specialized intensives training. You can learn more at scalingupemdr.com. Remember, when we bring EMDR into treatment centers, we're not just treating symptoms in the moment, we're laying the groundwork for long-term healing.